So with that, I'd like to bring in Mayor John Tory, who's standing by for his weekly check-in. There's a lot to discuss, and good morning to you, Mayor.
Good morning, Mel.
Thank you for joining again. I want to get your take here. This line, if we can bring that shot back up alive, it is unreal, and sadly, we continue to see these lineups. It's encouraging knowing that people want to get the vaccine, but again, it speaks to the need. So when you see something like this, people waiting in the elements, this day's not so bad, but we saw people waiting in snow, the cold, the rain. What is your reaction?
Well, if we're going to have the sort of mobile and pop-up clinics, and if we're on a provincial registration system that doesn't necessarily as yet allow for registration, say, of people who are 18 plus, part of the thing that people have commented on, and I think with justification, is we have all these different bands of ages of people who are qualified in hotspots that are 50 and people who are 45 and people who are 60. And the provincial registration system isn't as immediately flexible as it might be to accommodate all those different things. You have to make software changes and so on. So what you're going to get is, I think, a trade-off that most people will accept, which is better to have the pop-up clinics, the mobile clinics in the hotspot neighborhoods, even if you have to do it on what amounts to a first-come, first-served basis, than not to be able to have them. And so we're putting them on. People are lining up. I think the projections in Scarborough alone today, just in Scarborough, is to have 2 clinics like that with 3,000 people total getting the immunization. And I think that's the main thing, is we're getting people immunized. We really are, making progress with our health partners and with the community organizations to getting people immunized. Since I last spoke with you, we've put out numbers that showed that we went from a single-digit percentages of people vaccinated in some of those hotspot neighborhoods up to, 25, 35%. And that's a huge jump in 2 or 3 weeks. And that's what we're going to continue to do. And that's why all those people are lined up there today to get vaccinated, which is the good news.
I do want to give a special shout out to those who are operating these hotspot clinics. I know they're working around the clock and they're doing their best. And indeed, they have to deal with a lot of people who are frustrated, and that's understandable. So let's move from the vaccine clinics now to just what's going on in some of the regions, specifically with paid sick days. We saw what the province is proposing. That still needs to get passed. Do you think this 3 paid sick days is enough? Because we're seeing this in conjunction, obviously, with some of these hot zones where the vaccines are being stepped up with essential workers living in these zones. What is your take on 3 days?
Well, we don't know yet how it's going to work, because to me, the things that they really had to address were 3. One is they had to keep it simple, because you have to make sure that the workers who are affected, who sometimes might find themselves not feeling well and otherwise inclined to go to work sick, have to be able to make a snap decision that they're going to be able to have a paycheck to pay for their family's food, or some money for that. The second was the quantity of money. And I think this initiative by the Ontario government really will help, because it's not just the 3 sick days, but they're also paying a top up on top of the federal program that's there. And then the third is how quickly can people get the money? It isn't just the simplicity of applying, but how quickly can they get the money? And again, another good feature of the provincial 3 days is that will be actually paid by the employer. So that should be fairly easy for the employer to just continue to pay the worker for those 3 days. So I think it's a step forward, but I think they've got some details to sort out. And I would just hope 2 really good, reasonable people, I know them both well, Peter Bethlenfalvy, the provincial finance minister, and Christopher Freeland, the federal finance minister, would either get on a Zoom call together, or they can get into a room. There's no law or order against them having a meeting with masks on, and just sit down and sort this all out for the benefit of the people who need the help, and who, if they feel the slightest bit sick, should not be going to work. And they are now, because they think if they don't go to work, they'll lose their paycheck, and they can't afford to do that. So I just hope they can sort that out. But this appears to be a step forward in addressing those 3 issues that I mentioned.
And very quickly for you, Mayor Tory, CafeTO is a go. You've got a number of businesses who have signed on. And what is this going to look like, and will it expand? And just a reminder for our viewers, going outside of their space onto sort of the curb space and potentially into the roadway to help with business. And hopefully we'll be able to reopen at that point. Are you optimistic that we will be able to see some semblance of normal come, mid-May?
I have my fingers crossed. I have my legs crossed. I have my toes crossed. I won't cross my eyes because I'm trying to talk to you. But, we really want to see things reopen sometime into May, which is when we had sort of thought this order would expire. All we announced yesterday is for literally all the places around the city where we're going to put these patios into curb lanes. We're going to install the safety measures and block off those spaces in the curb lanes starting in early May, like in a week or so, because we want that to be ready the minute that the health authorities say that they can have outdoor dining again. We don't want to be sort of waiting for the day when they say the outdoor dining's okay and then start putting in these patios that you can see on the TV there. So we're just getting on with it so that these restaurants who are struggling so hard now not being open can get the revenue, and so that people can enjoy those patios the first possible minute that, and we've had 720 applications, by the way, for curbside patio, curb lane patio locations. So we're just going through them all, but some have already been approved, and we're going to put them in, put the material in, and get ready to go.
And let's hope they can reopen. Thank you so much for that.
Hear,
We
hear.
appreciate your time. We'll see you next week, Mayor Tory.
Okay, bye-bye. Thank you.
Thank you. 7-Eleven, I just want to remind our viewers there's some information that we're getting into our newsroom now. Deputy Premier Christine Elliott, she will be joined by Solicitor General Sylvia Jones, and they're going to have an update on the province's COVID-19 vaccination plan. So that's just coming into our newsroom now. If you want to watch that one live, it's at 1:30. It's on our website, which will stream, as always, citynews.ca, and hopefully it's some more encouraging news. Okay, let's join the gang now for what's going on today. Good morning, everyone.